Right. So in terms of, I teach, and so and education, everybody knows all the schools suddenly had to go online, and in New York and most other places. And so that was an incredible pivot, right, for instructors who were doing traditional face-to-face class. All staff had to start working. Everybody had to start working except the essential workers. And that was right away really interesting, right? So the food service workers who were still supporting people in dorms, house cleaning, those people, the people in those positions stayed or had permission to go on campus, and the rest of us were put off campus, right? And I'm not aware of university cleaners or food service workers getting any hazard pay like people in some other industries did. And so that's a very interesting thing to think about. So that was an incredible pivot. And I was empathizing with what Jennifer was saying about the guidance, right? We have been planning and trying to come up with the academic restart. We were waiting for the state guidance from New York State. It came out, it wasn't as detailed or as prescriptive, I guess, as some of us would have hoped. And then we're doing these plans knowing that at any time, because of the emerging circumstances, that everything might be changed in terms of what we have to do. And so universities are in a unique position because they have restaurant rules they have to follow for dining services, right? They have, they offer retail, they have retail space in terms of bookstores, they have dormitories, they have residential settings in addition to following the educational guidance. In terms of the labor in the family, there have been some low, not big sample time surveys and lots of anecdotal evidence that women are being hit harder than men with the unpaid work, right? With many people's childcare closing, not all of them, and with schools going remote or online, everybody is trying to work from home and parent their kids. Many people who might have reached out to grandparents for help in previous circumstances because they're in the high risk categories now, right? Are isolating from grandparents, so they didn't have that. So we've seen a lot. I'm bet there will be a bunch of studies coming out soon, but there's a lot of anecdotal evidence and some short studies supporting to how much harder that hit women. And I'll just mention, because I'm in academia, in terms of research, I've seen data that across many disciplines that the journal submissions for men went up between February and May, between the same time period last year, and journal submissions by women or all women team went down compared to the same time period last year. So the gap between those two, which is necessary for tenure and promotions, increased. So that also points to some of the dynamics that seem to be working out with the unpaid labor. And again, I think we've all been in a meeting where children have come in the background, and I am thrilled when that happens, because I think people need to remember, especially people who might be in executive leadership and who maybe aren't dealing with the same situations, that this is not business as usual. This is business during a pandemic. And so that's what we're seeing now, but I'm sure we'll get more detailed information in, probably 6 months to a year.
Yeah. And as you said, we're going to talk a little bit more about how some of that plays out in different ways.
Can I just add one thing to that? I'm sorry.
Please. No,
just on the part about people not being able to rely on grandparents and friends, it also really, it revealed the instability of our childcare system in general. So prior to the pandemic, childcare was in a crisis. It's an industry that's funded pretty much solely based on parent fees, but they can't control their costs because they have to have the right staffing ratios, the right space. And so it's always sort of been a little bit out of a price range. I mean, it's $15,000 to $18,000 a year for one child to go to childcare. And so a lot of people relied on informal arrangements, whether it's grandparents, friends, family, and that fell apart at the same time that schools were closed and there wasn't sufficient school-age childcare, because remember, school age can be a 5-year-old or a 6-year-old. And so it was sort of this perfect storm. And, I'm glad that you like to see children coming in, because as you saw, mine came in. And it was my oldest one, of course. But I think it just revealed the fractures in our systems that were already there. And as Onika said earlier, the cuts to healthcare, and we've been seeing that in childcare. I don't know how our industry is going to survive this without major investment, public money. But that point about the not being able to rely on those informal networks has really revealed a lot, I think, about how families use childcare.
Yeah, just on a personal note, my son and daughter-in-law are expecting their first child, and I'm ready to be tapped for the summer informal care network. And I thought, but this is for next summer, but I thought, good grief, if COVID's still on the horizon, I'm out.
Nobody wants
right?
it, yeah.
Yeah, so what are they going to do? It's an extraordinary problem. So that's a great segue to the next question. So are there policies on the table that would address some of the challenges that healthcare workers are facing, childcare workers, care workers in general, both waged and unwaged, elder care workers? What is out there that you see that could possibly be helpful in addressing some of the problems that you've identified? Jennifer, did you want to start?
Sure. I'll try to be optimistic. I think I'll start with the fact that the CARES Act that passed, I guess, a few months ago now, did include specific funding for childcare. New York State got $164 million to specifically support the childcare industry. They used a portion of it to help provide supplies to the childcare program. So it's PPE, cleaning supplies, and such, and we did that. And also to help essential workers who were below 300% of poverty have access to free childcare. That program ended on June 30th. The state has just launched a new initiative to provide some grant funding to programs who are able to expand their capacity. It was just launched. We don't know how it will play out. Again, not available in Spanish yet. And then there's about 50-something million left after that program that we're working really hard with the state to help stabilize the system. The HEROES Act and what Congress is looking at now is there is a bill called the Childcare is Essential Act that would have $50 billion specifically for childcare for the country. I have no idea if there's any shot of it being passed. I do hope that we'll get some kind of specific allocation for childcare and that our state uses it effectively. But just also, I think we need to remember that our state and counties need the aid from the feds as well, because even if we get childcare funding, but if our state and counties are bankrupt, we're still not going to be able to support any of our care systems. So it's all tied together. So hopefully the HEROES Act will have everything or a lot more than the CARES Act included.
Okay. Onika?
So just want to add, and yes, I will also remain optimistic, and it's going to happen. So yes, the HEROES Act, of course, we would hope that would pass, then it would go through the Senate. That would be really helpful. We all remember the CARES Act and what that was able to kind of support our membership. For New York State, we want the expansion of the sick leave legislation that's currently there. Doesn't provide enough sick days. Healthcare workers was originally kind of excluded from that bill, so we just want it to be expanded to include enough workers that are working. We've also been looking at legislation that targets our home care workers. They're often not the group that is remembered. They're usually invisible, but we want to make sure that they're considered as a group of care workers that we are able to allocate PPEs for them in the same way as we think about the other care workers. Pandemic pay is also something that we need to be able to think about for just specifically our home care workers. The other areas have been able to get funding based on the broad national conversation, but sometimes our home care workers are actually not always included in that. So that's really something we want to focus on.
Okay, we do have a comment I saw in the chat from Irv Miljoner to say that the care work, it should be noted regarding the CARES Act, that it specifically provides for paid leave for workers who are caregivers. And I'm assuming, Irv, that means not necessarily healthcare workers, but workers generally?
I think I think that doesn't that provision only provide for if it's COVID related?
Yeah.
The answer is yes to that. And for those who don't know, I'm the recently retired director for the U.S. Labor Department. And the provisions for leave under that act and some of the other acts, there's some evidence that those benefits are being pretty severely underutilized. People don't know about it, you know, and so organizations like some of yours are very important in getting the word out about the benefits that do exist.
Can I add something about the policy, the care policy? So I think Onika and Jennifer really hit on it, that we have had long-term systemic sort of underinvestment in healthcare and in childcare and in these sorts of, and elder care in general. And, you know, it's hard to overemphasize the extent to which the United States is an outlier among similarly affluent democracies. We're one of only 2 countries in the world without paid maternity leave. We're the only OECD country that doesn't have it. You know, we have much more meager compared to most Western affluent democracies, social safety nets. There's been attacks on food security by, you know, vis-a-vis SNAP. So our situation from this is much worse and tenuous because we don't, this was like a big care stress test, but without like, not a test in the trial runway, but test as in it was an exam and we failed it because we didn't have the resilience built in. So the CARES Act, I mean, sure, way better than no CARES Act, but it's, you know, it's ending soon. It's only addressing COVID. It doesn't include everybody. I think there's almost no chance of the HEROES Act being passed. The Senate is just so resistant to those kinds of proposals. Now, will we get some of the proposals or something that pushes that way? I hope so. You know, this might sound odd, but I think the fact that the COVID initially hit the coast worse, and so which statistically speaking tend to be more blue, and the heartland and the center later. I don't know if the fact that red, because, you know, right, we have elected officials from the states who are, you know, in some way beholden to their constituents. If we get people in the red states pushing their senators, then I'm more hopeful. But I am a lot more hesitant to think that to bank on that happening.
I'm glad you mentioned that because we're actually beginning to do that. We do recognize, and I think we all know earlier, those states were not impacted. They did not see the trucks outside of hospitals. They have not seen, you know, I've talked to one of our morgue attendants who on an average in a hospital would do about 5 bodies or death a week, was down to about 35 a day. And so that kind of impact is what healthcare workers was experiencing. And I think now, you know, we did not want them to be in that position, but I think they're beginning to see what that was like when, you know, it wasn't just New York, and New York was talking about it. And so because they're beginning to feel that kind of impact, we're hoping that they'll understand the urgency and the importance of us raising the conversation, because we've been through it. It's a really hard period of time to be in, and hopefully they'll be more likely to at least move some of it.
It's an interesting point how our political polarization has really hindered in so many ways our ability to respond to this. Jennifer, did you want to add anything? And it's okay if it's a pass.
No, yeah, I think there's nothing more I could say. Thank you.
Okay. So we've kind of alluded to this since the beginning, but I'd like to ask the question directly to all of the panelists. What's the relationship of care work to class, race/ethnicity, and gender? So I know we talked about it, and Tracy, you said it, you laid it out initially, but let's dig a little bit deeper there and talk about the kind of these kind of categories and lived experiences and how they factor into care work. Tracy, you want to start?
Sorry, I got distracted by a comment in the chat. So I think the International Labor Organization says 3/4 of unpaid care worldwide is provided by women. In the United States, unpaid care, women do something like about 37% more unpaid care daily than men. So sticking with unpaid care for a moment, there are different, if you break down by race and ethnicity, Hispanic women do the most unpaid care, and they have the biggest difference between what they provide and what Hispanic men provide. After that, I believe, is Asian American women. So across the board disparities by gender and unpaid care, and right, that's tied to economics, right? If men have the most high paying jobs and the biggest chance for career advancements, families often make a rational decision to prioritize the man's career. We do find when both people work full-time, that the gap closes between what, not closes, but gets closer between what women and men do, so it doesn't disappear. Obviously, there are cultural reasons too, and cultural pressures. Even women who make more than men often do more unpaid care work. And I'm sure that Jennifer and Onika can speak to this, but many of the paid care jobs are precarious, right? They do not get paid what you think they would get paid for their skills and their risks and their experience, compared to jobs that require similar types of skills but aren't traditionally coded sort of care or pink collar jobs. Political philosopher Joan Toronto talks about care passes. So the more privilege somebody has in our society, the more likely they are to be able to sort of get a pass out of performing care or performing as much care. And care is a burden and it's work, but I also want to say that it's not only a burden. Like there are aspects of the job that are deeply meaningful and can be joyous, but strained caregiving, we know, is involved with lower health, physical and mental health outcomes, and even higher morbidity rates for elderly people who are having strained caregiving. So it's a serious issue.
So so essentially the inequities of our society are reproduced in our care work system. So Onika, would you,
yes,
from your experience?
Yes. So and we've seen this for a very long time. It's immigrant work. It's work that, and I've often talked to healthcare workers who, and sometimes it's easy to understand how much joy and love comes out of doing some of the work that we know that they don't get compensated for doing. But that underlying element of, I care about my patient. I go to the supermarket for my client before I go to the house to do the 4-hour paid job, but I spend an hour and a half in the supermarket making sure they have the groceries that they need in order to do this. It was even more interesting as we talked to, as you realize that many of our many people in society started not going to the hospital during COVID, right? Nobody wants to go to the hospital anymore because it was not safe. And we were constantly talking to workers who were going into homes, not sure what you were walking into. You're not sure whether or not that client was sick or had COVID. We're in nursing homes where, which was impacted really hard for us. Obviously, we know that the state and the state government, made their guidelines and their legislation around what they wanted to see during this pandemic. But in a workforce where you had a nursing home floor, mainly women who were providing care and was unsure as to who they were providing care for, and that level of care. So we recognize that we're learning a lot from this. We're glad that we're learning a lot, and we're hoping that we're able to kind of implement changes that will just eventually beneficial, you know, in the long term. So just wanted to add that, because that's really interesting to me, talking about unpaid and care. It happens all the time. It's taking your client to the doctor's office and spending the extra 2 hours that's not part of your paid day in order to make sure that they get the care. And it constantly happens.
So there's a lot of unpaid care work that goes into paid, waged care work.
Care work, yes. It's really interesting.
I know we have some teachers here. I recognize some names. I think they would find that very familiar too, right? The labor that teachers do for their students, the supplies that they buy out of their own pockets. Why do you think that's so prevalent? Why is it just so, I mean, we don't expect, everybody else gets to expense what they do, right? Yeah. Why do we expect care workers to be so giving? Jennifer, you want to jump in?
Yeah, I mean, I think part of it is the type of people that go into this work, right? I mean, you, for the most part, become a healthcare worker or a childcare worker because you care about the people that you're caring for. And so you're just sort of going to go above and beyond, and those industries themselves are just not respected. I can talk about childcare. People see it as babysitting, you know, even though we know when done well, it is more critical or just as critical as elementary school. So I think it's a level of respect that they, unfortunately, as an industry, don't receive. But it's also, you know, 80% of the childcare workforce in New York State is women, and the majority of that group are women of color. Nationally, the breakdown between what early childhood educators look like and K-12 educators look like, I think it's 75% of K-12 educators nationally are white. And in the early childhood side, it's about 50% are women of color. So the industries look different as far as who's providing the care. And I think, unfortunately, the level of respect that follows just hasn't been there. And I, you know, childcare workers, I've worked closely with home health aides when my mom was still alive. They do go above and beyond in ways that you can't imagine. And yet you're right, there are people in other companies who won't move a box because it's not in their job description. So I think it says a lot about the type of people that go into this work. But it's also the disparities that we see in childcare are really a microcosm of the larger racial inequities that we're seeing and that we see in our communities. The average wage of a childcare worker is minimum wage right now, $13 an hour on Long Island. When I have to go fight for money because providers can't afford to pay their staff that, it breaks my heart, because I always say, why are we talking about paying the people caring for our children minimum wage? These should not be minimum wage jobs. Yeah. But they've never been seen, you know, different. Meanwhile, a kindergarten teacher is making 5 times that amount. So I think it's about our structure. And as Tracy said earlier, we're the only industrialized country that doesn't really support these jobs, these industries, and they leave families on their own. When you have young children, older parents, somebody who's unwell, there's no public will or public investment to really maintain those systems. And ultimately, I think that's why we see what we see in people doing all this unpaid care. Sorry if that was very roundabout, but
yeah. I just wanted to add to what you said, Jennifer, which was really, really important. Because one of the things when the pandemic hit, one of the first front line that we had to think about for our members were what were the childcare, right, that was going to happen for them. And so you find that that they're all intertwined and there's a need. Like there's no way you're getting someone to stay in the ER or work a 12-hour shift unless you figure out how their child going to be taken care of. And then when school closed, that created another layer of impact. So, and it's clearly intertwined. We're seeing how we're all relying on each other. And just hopefully, I'm hoping, just really optimistic, that there are others able to see it. Like I'm a mom of 3, and so teachers for me have a whole nother set of love, because just having to be there and nurture and do the smaller things that before was just, you know, homework was just, that's all I got to do. I don't have to teach you the whole curriculum. And having to do that created a whole nother dynamic. And I hope it's able to just lend voice to the bigger conversation about how do we kind of support this work and talk about how relevant it is.
It almost seems like there's an inverse, I'm sorry, Tracy, then jump in. There's like an opposite relationship between how important your work is and how I mean, right? The people who nurture our ill, you know, loved ones and our vulnerable young loved ones are the least respected, and yet you could argue they're the most important.
Yeah.
It's an odd relationship. Tracy, go ahead, I'm sorry.
And I think I couldn't agree more with what Anika and Jennifer have said. And I think part of the reason that we get the low wages and the lower respect for care work is because of its historical association with women, with work that women do. And the idea that this work is natural to women, therefore it's not skilled. It's just something they should be able to do, and something that you know people do for free. So why should we pay a lot for it, right? When we have to get it in the marketplace. Obviously that's fraught. There's a lot of things going in there. And the other thing is this sense that that everybody should cultivate their own garden, right? That we're all responsible. It's our choice if we have a family. So it's up to us to figure out how to pay for it. This sort of privatization of meeting basic needs, sort of without appreciating the way the system and the structure empowers some and fetters others to access the resources that they need. And so I guess to try to be more optimistic, you know, wouldn't we see the New Deal, right? After the Great Depression, and when so many Americans were influenced that it was hard to ignore what it meant to not have Social Security and unemployment benefits and things like this. Maybe we'll be pushing the envelope towards more robust federal or state care policies if it is felt across the country the way that the systems are in, you know, like we need to pay teachers and childcare providers and home health aides more because we realize how central they are to all of us being able to just go about our lives, and we rely on them. But I mean, I don't see huge changes coming. I'm a little more skeptical, but I do hope this pushes us forward. And I also hope that some of the flexibility in the working arrangements, that I don't suspect that the jobs will stay as flexible as they are now, but that may long-term help women and people with disabilities who have been sort of kept out of the labor market to have some better economic opportunities, perhaps.
Go ahead.
I just wanted to add to that, you know, we keep saying nobody's worried if our public schools are going to be there in the fall. We don't know what they'll look like. It may be a different type of education, but we will still have public school. We don't know if we're going to have childcare providers left, you know, how many we will have left. We don't know because there's no stability in that industry. And so it comes down to values as well. And we don't value those early years in the same way we do public education. But, you know, even kindergarten is not mandatory in New York State. So when schools cut their budgets, they can go back to half day or no kindergarten. So I think those are values that we make. And just one other piece I want to highlight, you know, with the increased focus on racial injustice and racial inequities, I hope, I guess, and I'm not very optimistic, but I will try to be, that we will address that in all industries. So I keep coming back.
Oh, Jennifer.
I think you've frozen, Jennifer. Yeah. Okay, while we're waiting for her to thaw out, I just wanted to pose a question. Do you think, Anika and Tracy, are we close to a breaking point here? I mean, I'm hearing that there's so much stress on the system. Can we take much more?
well, I don't know if I mean, it's hard to say, right? We've been dealing with this for decades. I mean, it was over 30 years ago that we even got the unpaid Family Medical Leave Act for people who were full-time for more than a year in companies with, right, over 50 employees, right? So it's been decades since that. I mean, I would like to think people would be more aware and to be more likely to support publicly support to deal with the hospitals, the disparity in wages, the childcare centers. But I'm not sure. I mean, if we get into another long-term lockdown again, I don't know.
No, I don't need. I think Jennifer, are you back? You're going to finish
back,
your
Jennifer?
thought.
I
Yeah.
am back. I am sorry. My
Go ahead.
internet has been very unstable, so hopefully you can still hear me. I was just saying that I think it's shameful that the state is putting out guidance around how to protect yourself as a child care worker and not translating it into the languages that a majority, not a majority, but a large number of child care workers speak. So in the light of all of the racial injustice and the new focus on racial equity, to me, that's just kind of the opposite of what we should be doing. And I see a question in the chat. Child care workers, only some of them are unionized. They are not part of 1199. So the home-based providers outside of New York City, so the family and group family, are part of CSCA. And in the city, the center-based programs that are part of the city contract for childcare are part of DC 1707. And the home-based providers in the city, a large number of them are part of the UFT. So I guess it was maybe 15 years ago the home-based providers did unionize, but it's a complicated structure because they're independent business owners, the home-based providers. But they do have CSCA is their union. We work very closely with them. And I think they just don't have the weight that maybe some other unions have, just because of the structure of childcare and because it's still fairly new as far as in organizing. But the city did get, through collective bargaining, some pay parity with public schools. So their center-based contracts about a year ago got a big win, which was really good to see.
So Jennifer, the question I had asked while we were waiting for you to come back, because you said something that sounded very alarming, which is that childcare centers, childcare providers won't survive. So do you think that we're reaching a crisis point? I mean, what happens if that happens?
I think prior to the pandemic, we were reaching a crisis point in childcare. We were seeing programs closing because they just couldn't make it work. So, every time the minimum wage goes up, if you own a center and you have 20 staff and you have to pay them all $1 more an hour, you can't charge your parents that cost because your parents are already struggling to pay the $13,000, $14,000, $15,000 per child.
Mm-hmm.
If you have a contract for Head Start or pre-K, your contract is what it is. There's no increase in there. So that was before the pandemic. Now you have to have smaller group sizes. You need to follow a lot more strict sanitation, health screening. So you might need more staff and you have fewer children. Without real support, we are going to see a good number of providers close. Upstate has already seen quite a few close. Here on Long Island, we haven't seen as many close yet. And then the school age, before and after school programs, many of them are also in limbo, given the fact that schools don't know what they're doing. So yeah, I mean, I'm not going to say everybody's going out of business, but the system will look very different and I think be much less stable if we don't get a good amount of support for the industry.
So we have some really good questions in the chat, but before we get there, I just want to pose a question to the three of you, and then we'll open it up to things that are comments and questions in the chat. And that is, do you see advocacy or organizing opportunities out there that we here and others like us can participate in to to help get policies passed or even introduced, and to help healthcare and childcare and elder care and care workers generally to be treated more justly. So essentially this is a how can we help kind of question. What can we do?
So let me just take an opportunity here. So I just wanted to comment on what's happened around, and just to answer the question you asked previously about, can we, will we be able to survive this again? And just taking a minute to kind of give it some thought. Well, because we know we're talking about hospital beds, and we're talking about what that impact was like. We had to work with schools in order to make sure that there were nurses that were immediately accredited so that they could get into the hospital and be able to become on the front line. All is what needed at the time, and resulted based on cuts that we've repeatedly done over the years to the industry, because we're like, well, we don't need 3 hospitals in the same area. Well, maybe we do, so that we can accommodate what's needed if there is a pandemic. And so just wanted to just kind of think about if we're impact with this again in a few months, and how are we able to kind of deal with this. We are right now having conversation. The members at Stony Brook Hospital, one of the state hospitals out here on Long Island, are currently advocating for pandemic pay. They're one of the ones in the system that did not receive it. So it's Stony Brook, Southampton Hospital, Eastern Long Island Hospital. They did not receive pandemic pay. Northwell, and some of the other hospitals were able to kind of provide a pandemic pay to their staff. And that was helpful. Northwell even provided to their home care workers. And that was really kind of a standard that they set. So just to ask how you can, if you know anyone in Stony Brook, or make a call into Stony Brook, that's helpful. Just because it's the state hospital. It's the state hospital that we have in Long Island. And we can talk about where we've moved from hospitals being publicly run to privately run hospitals, and that we're not exactly giving voice to the public hospitals. And those workers have done tremendous work given the standard that they're in. So just wanted to add that.
Great, thanks. Also, by the way, Northwell is Hofstra's partner, so
Yes.
I'm happy to hear that we're leading the way in treating healthcare workers.
Yeah, that's the standard.
Doing right. Good.
I would like to just add, again, to go back to, we need our entire congressional delegation to support the HEROES Act, and we really need sufficient state and county aid. It's our state and our counties are going, they have deficits that are unbelievable, and it's not, typical the state has a deficit. They always have a deficit. This is a really difficult time that they have no cash flow. And so all the health and human services that have state contracts are going to see delays in their payments. And we're going to start seeing the health and human services infrastructure become even more unstable if the state and counties don't get some federal aid. So it's not just about, it's everything, right? We need childcare funding. We need the healthcare workers to be supported, but we need our states and counties to also be supported. Suffolk County, I know, their primary source of revenue is sales tax. Well, sales tax hasn't been, coming in the past few months. So they're facing $1 billion deficit. I believe Nassau is in a similar position. That affects us in our industries in kind of, on the side. It's not the direct funding we get, but it's problematic. So I think making sure our congressional delegation knows that, and then just putting pressure on the governor to make sure he remembers that he said childcare was essential and that they should provide the support that they need.
Yeah.
And I will just, great points by both of them. Anything you can do to act collectively, whether it's in your workplace, right, to push for policies that are better, that help and serve everyone equitably, and or anything you can do not just to be a good person and pay someone a fair wage if they're coming into your home, but to send that letter to your, whether it's your New York State legislator, like as Jennifer saying how important the state rules are, or whether it's to your US congressperson, that we really, we're past the time for individual actions. If we want a healthy and more equitable society, we need to work collectively and we need to think politically. Take the lead from the industries, the people are in the trenches, right? To look at what the people like Nika's union and Jennifer's organization are advocating, because they're the ones who know about this stuff, right? And then to work politically to get those sorts of things done.
Great. Anyone else? You want anything else on that line that we can do? So we've got our homework laid out. Terrific. Okay. So is there anything else that before we open it up to the chat and the questions, anything else that our panelists would like to add? Anything you would hoped we covered and didn't get a chance to talk about? Okay.
Nothing for me.
Okay, good. And feel free to jump in with something if it occurs to you. All right, so we're going to go back into the chat. We have a question. I believe this is from Alexandra. Jennifer, and this is earlier on. Jennifer, when you say expanding capacity, do you mean adding more children to existing childcare centers?
So this is for what they're calling CARES Part 2. The state put out a program for providers to apply for grants to either support their space so they could have more children in their space. So whether it might be room partitions, additional supplies, and they can apply for a grant of transitional operational costs if they are going to increase the number of children in their care. It's, to be very honest, it's a little bit confusing, but the goal is to increase the capacity of childcare. So a lot of programs that remained open had fewer children in care. So they want to see them increase, so I'm thinking of a center has usually 8 classrooms, but they've only had 2 classrooms open. They want to see them open more classrooms to serve more children. And then the programs that closed altogether to help them reopen. So it's not necessarily saying my licensed capacity is going to go from 50 to 75. It's my enrollment will increase, and so I have to add another classroom. My struggle with this is that it really leaves behind the providers that remained open through the entire pandemic, who also lost a lot of revenue because they were not at full capacity. So family providers, this will be they pretty much are not going to be able to get it, and even group family will have a hard time getting it because of the way it's worded. So, and then the other big piece is we don't know what the demand is going to be, right? We don't know, we haven't seen a huge demand for childcare come back yet. As much as there are parents like myself who are ready for our kids not to be home 24 hours a day. My boys' camp was canceled. But we just haven't seen that huge demand. There's been the essential workers who've needed care all along, and slowly there's been a trickle of parents who've needed it. So it's not, what we really need to do is support providers so they don't go out of business. And that's really not what this program is targeted to do. But again, they just announced it. We're still working out the details and looking at what it means. It's all available on the OCFS website. And we'll see what happens.
Great, thank you for that. Nora Higgins from PEF raised her hand. Nora, did you want to contribute to the conversation?
Sure, I just wanted to make a clarification in regards to the HEROES Act. All of our House of Representatives have already voted on it, and it's passed in that House. So it's our Senate that we're actually looking to have, that we need to call and get shook up a little bit. We actually have our senators for New York, our federal senators for New York actually have already signed on. So what the ask is that people, if they have family members or friends in these, and I'll list them, states, to call their senators to convince them to sign on. And that would be Arizona, Florida, Kentucky, Maine, Pennsylvania, West Virginia, Colorado, Montana, Ohio, and North Carolina. And I just wanted to piggyback also on Onika. So the PEF Union, along with 1199, is going to have a rally on July 22nd. And we're all going to basically be having, from what I heard, the same signage, but with our own union's representation symbol, that heroes don't get zeros. And,
Oh, I love it.
and we're going to be marching from the South P lot all the way up to into the hospital, in the front of the hospital. So that's July 22nd. So if somebody's really bored that day, maybe get the kids out with you and come for a rally. Specifics to follow as far as the time that we're going to get going, but that is July 22nd. So I just wanted to put that out there.
Nora, is there a way you can type this into the chat so that people can see, see the states and also the details of the action that you just mentioned?
Yes, ma'am.
That would be terrific, because that's a very concrete thing that we can do. And Marjorie Harrison, on that note, also added to the chat that the AFL-CIO and other groups are running virtual phone banks for calls into senators' offices who need to be prodded on the HEROES Act. So yeah, if we can get people to do that, that would be our contribution to maybe getting this thing passed, right? And we have a comment that I think is really beautiful from, I hope I say the name right, Amarel Corley. My last name, as you can see from my my image, is almost impossible to say. So I apologize if I don't say anyone else's name properly. I understand what that feels like, because well, you can see. So Amarel Corley says, what happened to empathy? That it doesn't take a rocket science degree. And I think, yeah, we're looking at a moment where that's in short supply, and we probably need it more now than we ever have. Maria Lasella, since Reagan, the conversation has shifted regarding childcare. In the late 70s, around the time of Roe v. Wade, childcare, let me just make sure I can get this. Childcare was linked to reproductive rights. Shifted with Reagan, it went from even corporations trying to set up childcare at the workplace, but soon fell back to private models. Maria, do you want to say something about that? I'm not sure that I understand.
Can I just add something too that's
Sure.
really, it makes me very angry when I learned it. And there's a really great documentary, which of course I can't remember the name of it, but I will, and I'll put it in the chat. There was a comprehensive universal child care bill that passed through both houses of Congress in the 70s and was going to be signed by President Richard Nixon. It would have provided comprehensive preschool child care. And Phyllis Schlafly, who I believe there's a documentary about her on right now, took it up and really started opposing it because they felt that they would be indoctrinating young children and that women should be home with their children, and President Nixon vetoed that bill. Then there was another bill that Geraldine Ferraro had put forward, and there's been some additional bills since then in Congress to have much more of a comprehensive child care system. They've never gotten as far as they did in, I think it was 1971. And then Nixon vetoed it. So there's a history, and quite frankly, in World War II, we had universal child care because women had to go work in the factories. And so we recognized that women needed child care to work. And our Department of Defense still has one of the best child care systems in the country. I mean, it's on a sliding scale because they know that their soldiers need to have access to child care if they need them to work. So we know it's the right thing to do. We've done it before. There's just not the political will to do it right now.
So Jennifer, that's really getting at the question that we asked earlier about the way our social inequities, right? And the social roles that we assign people to and how that affects care policy. So women are supposed to do this at home. We don't need a comprehensive national child care act because that violates the traditional, responsibilities of women, of mothers to their children.
Right. And I think Tracy said earlier too, and we hear this a lot when we push on our advocacy, is, well, if you can't afford children, don't have them.
Wow.
Personally, I don't know anybody who can afford children. They are way more expensive than you ever think they will be. But that is also one of the kind of patriarchal pushbacks that we get on this.
And,
Wow.
and since Jennifer mentioned it, I'll add, I'm glad you did, is military service members have the most robust social services and safety net. It's like they have European style benefits, which I'm not against. I just would love to see them for everybody to have sliding scale childcare and the kinds of extended leave and housing supports and allowances that would all go to making caregiving more equitably distributed in our society. And it's interesting, it's partly moving to the all volunteer force. So part of it is supply and demand, but also that sense of they deserve it, right?
Mm-hmm.
And so how can we expand that sense of who deserves it and that everybody does, right?
Yeah. Well, so Maria Lucella had another question too. Jennifer, this gets at what you were talking about. If child care center closes, what happens to people who depend on them for their jobs? What kind of impact will this have?
So when that happens, my agency as a resource and referral will work with the parents to try to find another provider that meets the family's needs. It is very disruptive for the child and for the parents. You know, we're always asked, well, how many people don't work because they don't have childcare? And I don't think there's a real answer to that, because I think, especially, you know, in a place like Long Island where people need to work to survive, they'll figure it out. It might not be great arrangements, it might not be safe, it might not be stable, but they will figure it out to go to work. So we don't really have good data on what happens when the care is gone. I will say that in Quebec, when they introduced universal child care about 10 years ago, over that 10-year period, the participation of women in the workforce went up by 17%. So in places where they've put in place universal child care, they have seen women's participation increase. So it's hard to show the who's not working because of it, but you can show who does start working when it's made available.
And I just want to add, there's also, you have to make different options, right? You choose a job that's not as, doesn't pay as well because you need the flexibility of the schedule. So that impacts the family economically. And so it may not be to the extent where somebody doesn't go to work, but you'll have someone who takes a 4-hour case or job because that's all they can do, because you have to be home to pick the school-age child up from school at 3 o'clock. So you're not able to work an 8-hour day. And we all know what effects that will happen, right? Housing changes, your childcare changes. So just wanted to add that to the conversation.
And we have a comment from Greg DeFreitas about the Institute for Women's Policy Research about a report that they put out providing unpaid household and child care work in the United States. And that was even before COVID, right? Okay, good. So we've got a thumbs up from Tracy. So should we be then pushing for a return to what almost happened in the early 70s? Should we be pushing harder for childcare, comprehensive childcare packages? I mean, I've heard it said by people recently that among the most radical things we can push for would be universal childcare. Is that true?
I wouldn't call it radical. I think it's actually very logical, and most countries have figured it out. But I think for our country to do it, it would be, especially now, it would be shocking to me. I mean, there have been bills floated around that I have not seen move forward. As a member of the governor's child, he met with the Quebec folks and the researchers who put that program together and did extensive economic research on it to look and see if we could do a pilot in New York State. We were, I won't say we were making headway, but we did have the Division of Budget doing analysis to at least see what it would cost.
Someone in the, oh, sorry, Jennifer's frozen.
Yeah.
Go ahead, Tracy.
Go ahead,
So
Tracy.
someone in the chat mentioned, and I thought it was good, a good point is that, so obviously we've been talking more about childcare, but senior care,
Yeah.
long-term
Yeah.
care is increasing. It had some of the biggest growth, adult care. And I note that men of color were, even though they're lower than women, had the biggest growth in that industry. So given the changing demographics, it could be very strategic to try to put together the child care and the adult care to try to move them forward together, to try to build coalitions around that. But again, there's a lot of political polarization. Maybe this experience gives people more ammunition more incentive to organize. The other thing I would say is the income inequality is an impediment in some way, right? If the most affluent people don't have the same challenges to access care that people with less resources have, it's harder to build a coalition across that group. But again, if most people are the 99%, so maybe that's a group that has solidarity.
I think that's where MRL's comment about empathy comes in, right? If we're going to build these coalitions, we need to really work across these gaps. Jennifer, did you want to finish I think you're back. Are you back?
I'm back. I am so sorry that my internet is not reliable. I don't remember what I was saying. I'm sure Tracy or somebody else or Onika picked up the point.
Okay. Do we have any other questions in the chat? Oh yeah. Well, yes. Our affluent neighbors rely a lot on immigrant care work, which is, I'm sure that's something that, Tracy, that you have found in your research also, the way in which primarily white affluent women kind of fob off the care work onto immigrant women of color.
Well, I would add that it would be white affluent families because it's not just a woman's issue. But yes, right,
Yeah.
they're considered the surrogates because of the way we gendered our thinking about care work. Absolutely. And the National Domestic Workers Alliance, they've done fantastic work about this, around this issue.
Yeah.
And I think it's interesting. We've seen upstate where there's large refugee populations from Somalia and some other countries where they've, I won't say forced the women into healthcare or childcare, but there are programs specifically designed to train the immigrant women to become childcare workers so that they can, go work. So it's almost like they come here, there's a large population of a certain immigrant community, and this is what is offered to them. So I don't know if it's because they expressed an interest in it or just because this was what they thought that they could do. But I think it's interesting that where at least statewide in my network, I've seen where these large populations of refugee women, they put in these childcare training programs for them to go into the community to provide childcare.
So we've got a request. Nora, if you could put the information about the rally time and place. Also, I see you have a hand up. Is that from before, or is that another hand raise?
No, sorry, that was a leftover hand raise. Yeah, it's going to start in the South P lot, but I just put a text out to get the exact start time. I think they were talking like 9 in the morning, but I don't want to mislead anyone. So hopefully that'll come back and I can chat it back up.
Okay. If not, you can email it to me and I can send it out to anyone who's interested. Also, if you could, again, indicate the states where the senators are being phone banked.
I did list it.
Yeah, she did.
Oh, okay, good. I'm sorry. I must have, I think, oh, I see. Okay. Yep. Okay. Terrific. Anyone else with a question that you'd like to put in the chat? Okay, we have 2 raised hands. I'm happy to call on. Yes, Dick Kubek. Yes, did you have a hand raised?
I think you're muted.
Muted.
Or you have to unmute?
Okay. Yeah, I'm on. So listening to the definitions of care and the different types of care work that we've heard, we're really talking about people who are the most vulnerable and least productive in our society. The very young, the very old, the sick. They don't produce. And so to me, listening to this is really an indictment of the core ethos of our system. If you don't produce, if you don't make money, if you're not productive, you're useless. And so the people who serve you are therefore among the least valued because you're among the least productive. But I think when we look at other Western countries and industrialized countries, there's a different ethos. So anybody want to comment on that?
So yes, it's an indictment on our society. I agree. What I would try to reframe, though, is that yes, the young, the old, the sick need care and in specific ways, but actually every single one of us need and rely on care every day in every part of our lives, right? We cook for each other. We need people to talk to express our emotions. We need, we rely on, people who are each other to do these things. So I think one of the things that care theorists have tried to do is it makes sense, normalize care, make people see all the ways that they might not recognize that they're a beneficiary or needing care, to try to build that sense of solidarity. But yes, I mean, I think the divisions in our society are tendency to be drawn to individualism. And let's be honest, the racial and class divisions in our society all make this a challenge.
Indeed. And either of our other panelists want to address the comment?
I think, on the part of the young children, I think people think little kids aren't learning, right? They're just being watched. They're not being developed and nurtured. And we've been trying to show, we have science now that shows how much the brain grows in the first 3 to 5 years of life. And so we've tried to change that narrative of those early years are in some ways more important than, what electives you're taking as a senior in high school. But we haven't quite made that shift yet. I mean, there's been a little bit of a recognition of it with pre-K and other things, but learning starts at birth, and quality early learning opportunities impact a child for the rest of their life, and we have all of that. So, hopefully that narrative will continue to help us make that shift so that people don't just think, well, these are just little kids and they don't matter.
Mm. We have two really good comments about that. One is a book recommendation, Caring Democracy by Joan Trano. And then the other is, it wouldn't be a forum if we didn't somehow connect this to the benefits of joining a union or a worker organization if it's not possible for you to join a union, and challenging that ethos with collective action. Yeah, I mean, that's, I don't know, Annika, if you want to comment on that.
No, I think that's, thank you for that insight. And obviously we've given this some thought over the years, but I feel like more so now, as mentioned, I think we've seen what collective power can actually do. And so I think we should be a little bit more thoughtful in planning this. So I think the discussion around pairing childcare with senior care, let's have a conversation around that. It makes sense. Yeah.
Yeah, and you know, historically, one of the issues that has made it a little bit more difficult to organize workers who do childcare or domestic, and we haven't even talked about domestic workers, is that they tend to work solo. Many of them.
Yeah.
As opposed, you know, the old model is, right, everybody's gathered under a factory roof and we can go in and organize them. So how do we organize workers who are in people's houses on their own? I think the Domestic Workers Alliance has done great work modeling that, but it's challenging. I don't know if you wanted to comment. Has Jennifer, she's still here?
I'm still here.
Okay.
I think that's, you know, these are independent business owners that work alone. And so, right, it makes it, even though they're unionized, it is, I think, challenging to really have that collective effort. Although I have seen CSEA engaging in different ways right now that I'm really happy to see.
I think one of the things we find, especially in organizing and home care worker, which is you definitely have less access to, is once you find a common interest, I think you find, and you know, some employers are actually wrestling with some of the same challenges we are. Like they understand that funding to the state and to the county makes a difference in how they're able to deliver care. And so finding and kind of streamlining what our common interests are generally at times, you know, work.
Okay, yes, so we have, Nora has put the information about the Stony Brook action, the specific directions in the chat for anyone who's interested. Please look for that. Thank you, Nora. Anyone else, any questions before we wrap it up? Either with a raised hand or in the chat. We got a thumbs up, thank you. Okay, great. Well, I can't thank you enough, panelists, Anika and Jennifer and Tracy. Again, thank you for sharing your insights and your experiences about this really important topic. Oh, Diane has a hand up, please, or is that a clap? It's a clap, okay, good, all right. Thank you, everyone, for this, and I hope that we can have some impact by calling our senators. Those of us who can show up to Stony Brook, we'll do what we can, and yeah, we'll see if we can make some kind of positive change. The next forum, as I mentioned, is August 4th, and we will be discussing immigrant workers. And we sort of danced around that topic a little bit today. We will dig in more directly and deeply on August 4th. I hope that you can join us, and I really do appreciate that you joined us today. And I hope you found this as engaging and interesting and informative as I did. So thank you, everybody.
Thank you.
Yeah, and thanks for all the good work that you do, all the organizers and activists out there. Really, I don't know what we would do without you. So thank you.